Hello everyone, my name is Dr. Muhammad Maaz bin Rehan and I am an internal medicine resident at Advent Health, Sebring, Florida. Today my topic of presentation is efficacy of metformin in prevention of glucocorticoid-induced hyperglycemia in patients without diabetes, which is a systematic review and meta-analysis. First of all, let me give you a background. As we all know, glucocorticoids are increasingly being used in managing autoimmune conditions and cancers. While they provide strong anti-inflammatory benefits, their use is often complicated by hyperglycemia and increased risk of diabetes. Metformin through AMPK activation has the potential to reverse these metabolic complications while preserving glucocorticoid benefits. Given the high prevalence of steroid use and established burden of steroid-induced hyperglycemia, we aim to systematically review and synthesize the evidence on whether metformin can help prevent these metabolic disturbances in non-diabetic patients. Moving on to the methods and materials that we used. This meta-analysis followed PRISMA guidelines. We performed a systematic search across PubMed, Cochrane, trial registries, and Google Scholar from inception to June 2025, including randomized controlled trials and observational studies. Primary outcomes included fasting blood glucose levels, glucose area under the curve, insulin resistance measured by HOMA index, BMR, body weight, and lipid profile. Statistical analysis was performed using Review Manager software, applying a random effects model to address heterogeneity, which we assessed using the Higgins I2 index. Risk of bias was evaluated using the Cochrane tool. Moving on to the results, our study showed that preventive metformin administration during glucocorticoid treatment is superior to placebo with respect to glycemic control, as shown by statistically significant reduction in fasting blood glucose levels by a mean difference of -0.6. Metformin administration during glucocorticoid treatment is also superior to placebo with respect to glycemic control by HOMA index of insulin resistance by a mean difference of -0.53. Metformin also showed that it is superior in respect to placebo in reducing LDL levels and total cholesterol levels. However, our study failed to show significant improvement in area under the curve glucose after challenge, improvement in basal metabolic rate, improvement in HDL levels, insulin levels, triglyceride levels, or body weight. So in conclusion, we can say that while glucocorticoids remain essential in various clinical contexts, their detrimental impact on glucose metabolism is well documented. This study supports metformin as a promising preventive treatment in non-diabetic patients receiving systematic glucocorticoid therapy. Improvements in insulin sensitivity and resulting fasting blood glucose levels may offset glucocorticoid exacerbated inflammation processes. Having said that, further studies are still needed to address long-term outcomes including adiposity, bone metabolism, appetite, liver function, muscle wasting, and identification of possible predictors of therapeutic response. Thank you for your attention, and I would be happy to take any questions.